The producers have no financial interest in the product matter shown in this film. Up to 5% of all blindness are due to ocular infections. The global estimates of microbial keratitis, the cause of unilateral blindness, ranges 1.5 to 2 million cases a year and 58,000 registered emergencies in the US. In our part of the world, 113 of a lakh population have become blind monocularly following microbial keratitis. Presently, the treatment is primarily topical dosage forms as eye drops and eye ointments. However, precorneal factors and anatomical barriers affect their contact time with the lesion negatively. Introducing a novel concept of drug repository contact lens system, the antimicrobial lake. The drug repository contact lens is a therapeutic soft contact lens for continuous wear up to 1 to 2 weeks, made of aquaphilicon A and water in a buffered saline solution. This consists of a unique design of dual base curve as to result in a central reservoir for drugs and fenestration holes to enable capture of applied topical antibiotics. It's a novel technology aimed towards prolonging drug corneal contact time for effective healing and reduced frequency of application of eye drops. We conducted a randomized controlled clinical trial to test this hypothesis, comparing topical antibiotic alone and topical antibiotic with repository contact lens in cases with bacterial keratitis. By measuring ulcer and infiltration sizes using bacterial keratitis score, pain analog scale, improvement in vision, corneal haze, anterior chamber reaction by 12 hours, day 1, day 3, day 5 and day 14. Case category 1 included bacterial keratitis less than 4 mm in maximum dimension and were subjected to repository contact lens with topical antibiotic monotherapy of moxifloxacin, second hourly for 3 days and 6 times a day till recovery. The average resolution of infiltration by 12 hours was 0.66 mm, by day 1 was 1.27 mm and day 3 was 2.06 mm, which was significantly better in the first 3 days in the repository contact lens group. Hence, we recommend the treating physician to decide whether or to continue the contact lens after 3 days based on the clinical signs. Bacterial keratitis healed within 5 days with contact lens system and after 5 to 7 days when antibiotic alone was used. A mean of 1.5 lines improvement in vision was noted by day 1, which improved by another line by day 3 in the repository contact lens group against only drug group. The pain reduced in the scale by 2.7 points at 12 hours, by 5.29 points at day 1 and 6.86 points by day 3, which was significantly better than being treated with drops alone. There was a significant reduction of corneal haze and reactions in both the groups, more so with the contact lens group in the first 3 days. Category 2 cases were bacterial keratitis larger than 4 mm in their maximum dimension, treated with a monotherapy of moxifloxacin in gram-positive group of organisms and with amikacin in gram-negative group. The effective healing by means of improvement in bacterial keratitis scores and the reduction in pain scale of larger ulcers started by 1 to 3 days, and the ulcers were completely resolved before 2 weeks in patients treated with repository drug contact lens group. We aimed in retaining the drug in the precorneal space like an antimicrobial lake using a specialized dual base curve lens system rather than the attempts of sustained release properties tested using regular therapeutic contact lenses soaked into antibiotic solution before its application. Also, the fenestrations in the lens enabled further capture of medications whenever applied. Triamcinolone, used as a staining agent in the presented vitreous during surgeries without staining the lens, was used as a testing agent in the drug retention studies. The drug availability in the central reservoir peaked immediately and were detected in the potential precorneal space up to a maximum period of 4 hours, favoring extended drug corneal contact time, tested both by OCT and clinical photography. Occasionally, mucus strands were found in the precorneal space, clogging the fenestration holes. We recommend that it could be washed with BSS, or the lens may be removed, washed with BSS and reapplied. To conclude, from our randomized control studies, the drug repository contact lens system promote effective healing and early pain relief in the treatment of bacterial keratitis. This novel concept is effective in prolonging antimicrobial availability in the precorneal space over the site of the lesion, which could affect the overall outcomes in bacterial keratitis. Employing a drug repository contact lens may reduce antibiotic regimen and the burden on the medical staff, and also could improve patient tolerance and may change the present practice patterns.